Hello, today we are here at Fairview Park Hospital and we are with Dr. Francisco Jacome, and he is going to be giving a seminar here at the hospital today in a series of seminars that you do for the hospital for educational purposes, and we're going to be learning about GERD today. So tell us a little bit about GERD and what that stands for.
So I guess a better way to put it is everybody knows it as heartburn. So there are several ways that you can refer to GERD. GERD is pretty much reflux of acid that goes from the stomach into the esophagus and creates a sensation of burning.
Right.
The esophagus, the first part of the esophagus from the bottom up sits right behind the heart, and that's what people call heartburn. And that's what that stands for. It's gastroesophageal reflux disease. So GERD has several different types and several different consequences. But it's a very common problem that we have. It's a very common problem in the communities that is not addressed appropriately and can carry really bad complications in the future, including the risk of developing esophageal cancer.
Wow. So is acid reflux, does it run in a family? Is it genetic?
So there are several ways of looking at it. It usually is, it has some family component, but it has not been defined as a genetic disorder. There are some instances where babies are born with reflux and then it gets better over time. But the reality is when the pressure inside the abdomen overcomes our ability to retain the fluid there is when we develop the reflux. A lot of the time has to do with increasing weight. So the more weight that we gain, the more prone we become to have reflux related to that. There are some people that don't have any increased weight that do develop reflux, and that's a failure. That's a failure of the muscle that retains the fluid in the stomach to prevent that from happening. From there, you have also many other problems that can create reflux, including hiatal hernias and dysmotilities, meaning problems with the actual function of the esophagus.
And so sometimes this becomes such a problem that it requires surgery, and that's something that you perform?
Yes. So the first line of treatment for reflux is definitely not surgery.
Right.
Surgery is the last resort to be able to heal a person from reflux. Now, the problem is that once you give a patient medication, if the circumstances don't change, the patient will require to have that medication for life.
Right.
The problem is that there is no medication that is 100% safe. And taking a medication for reflux, we know Prilosec, we know different other medications, Zantac, whatever it is, if you take it in a very long run, it will carry complications. It will carry side effects. It can damage your kidney, it can damage your bones. It can carry a lot of problems. So when is the right time for surgery is when a patient is not being able to be controlled with medication that reflux continues. And the other indication is when the patient either cannot have that medication for other medical issues or the patient does not want to have medication for life.
Right. So it could, that medication could conflict with other medications possibly that they're on?
Correct. It can conflict with other medications. It can affect other health issues as well. And at that point, it's better to avoid having that medication, and then it's when surgery can become an option. You know, there are other, and it's a little bit more complex to really qualify who will be able to have surgery for reflux, but try to break it down a little bit more simple is if you have a patient that has no control under medication, if you have a patient that cannot take medication for life or cannot afford the medication, if you have a patient that has a hiatal hernia, fixing a hiatal hernia can stop the reflux as well. Or a patient that is having problems with so much reflux that during the night they reflux and they have choking episodes, which can be life-threatening. So the decision when to have surgery is a little bit more complex because there is a group of things that got to be taken into account before proceeding with surgery.
Sure. I mean, I would assume that at that point, surgery is kind of the last resort. It's the last thing that you can do to help this patient have a comfortable, easy life, correct?
Yes, because a lot of patients are so used to having reflux, so they really can't live life to the full because they were so afraid to have reflux. They're afraid of the heartburn. They're afraid to go out to eat. They're afraid of Mexican food. That's a big one. They're afraid of a spicy food. And the reality is that there's no need for all that. There are solutions. There are options. And it's always a good idea to talk with your primary care doctor or as a referral to a surgeon to see what other options are. In the past, the only option was either you get medication or you have surgery. So now we have options in between that don't necessarily require surgery, but there are procedures that we can do without the need of surgery that can fix the reflux.
Such as the hernia repair that you were talking about, or is that considered a true surgery?
That's considered a true surgery. So there are procedures that we can do through endoscopy that doesn't require any cut in the abdomen, does not require any it's not as invasive as going into the abdomen to fix the problem.
Right.
It requires to do an endoscopy, and we can create a valve through endoscopy to prevent the reflux from happening.
And so the surgery itself, are you going in and repairing that muscle that is no longer working and keeping that acid down in the stomach area?
It's not so much repairing the muscle, is reinforcing that muscle with a valve that is created with the stomach itself.
Right.
So the way this valve works is based on pressure. The moment that the pressure is generated in the stomach for the reflux to happen, the valve closes and doesn't allow the reflux to happen.
So if a person, I assume, is that far along or is living in that much discomfort and they decide to, or you decide that surgery is the next appropriate step for them, I assume that one of the questions would be for any of patient would be, at that point, will their insurance cover that because it's debilitating their life to an extent that it's, it's not comfortable for them?
Yes, we don't have a problem getting the surgery covered by reflux. The surgery covered by the insurance. We don't have a problem doing that. We know what the appropriate things to look for are. We know who the good candidates for surgery are. And a lot of people think, that this is a major surgery. You're going to have a big cut. You're going to spend, in the hospital several days. The reality is a surgery that is done minimally invasive. So basically, we make little cuts on the stomach. We go inside the abdomen. We create the valve or fix a hernia. Most people are going home the next day by noon. So it's pretty much an overnight stay at that point.
Well, that's great. And I'm sure those patients, I've known people in my life that have this chronic, acid reflux, and I'm sure that if this surgery really works and relieves those symptoms, that it's pretty life-changing for those people.
It's definitely life-changing. It's definitely a life-changing surgery that can improve your quality of life majorly. But I would like to go beyond just a life-changing event. Chronic reflux that is not very well treated creates changes on the esophagus. The esophagus is an organ that is not designed to tolerate acid. So the moment that it's constantly bathed in acid, it makes an effort to adapt and change to be able to tolerate the acid, but it doesn't do a good job. So the way that the esophagus is changing makes the esophagus prone to cancer.
Cancer, yeah, what you
so
mentioned.
Untreated reflux can develop into cancer. And curious enough, the state of Georgia is one of the states that has the highest rate of esophageal cancer. And the reason is because for whatever the reason is, we don't treat reflux appropriately. So I do want to emphasize the need of treating reflux. It's not just a heartburn. It's not just, okay, I'm going to take a Tums and I'm done, or I'm going to take a Zantac and I'm done. It is an important problem to pay attention to so it doesn't develop into something way more complex in the future.
Yeah, that's very important. Because once it reaches this stage of esophageal cancer,
yeah, the options are totally different. Then, esophageal cancer is one of the most aggressive cancers, one of the most difficult to treat, and one of the ones that had poor prognosis in general. So esophageal cancer is definitely not the way to go.
Well, I think that's really important. I think of a lot of the things that I've heard you say right here, for you to say that Georgia has one of the highest instances of cancer, which is most probably related to the fact that we don't properly treat this disorder. Correct. Is important. That's really important that you just told us, and hopefully that the viewers listening will, maybe reconsider, taking advanced treatment to resolve this issue.
Yes. So again, it's very important to talk with your primary care doctor, present what the problem is. Usually the primary care doctor has no problem starting the patient on reflux, but pay attention to your symptoms. Don't let it go untreated. Don't let it go to the point that it can create a true damage.
Wow, that's interesting. That's great information. So you will be presenting this here in a seminar at Fairview Hospital today.
Yes.
And just trying to basically educate the public about this disorder and some of the possibilities for treatment.
Correct.
And, even like you said, trying to find the fine line between where you have traditional treatment versus a surgical procedure.
Absolutely. Absolutely. So it's the most important thing is to have a patient population that is educated.
Sure.
You got to make sure that the patient understand what the disease process is and how does it work, and what are the treatment options. And a lot of the treatment options do not require a major life-changing event. It's just simple things that we can do on a daily basis just to avoid having a problem.
And just improve your quality of life greatly.
Quality of life. Absolutely.
Fairview Park is really, really great. I know that they do a lot of seminars, a lot of public outreach, and it's really a wonderful thing, the way that they try to support and educate society. How often do you do these seminars here?
I think I'm doing probably 1 or 2 a month, depending. I come here and I stay here for about a week every month, and I'm usually doing at least 1 seminar a month.
Do you happen to know where the general public can go to and find out information about the seminars?
Yeah, they can go to the website for the hospital.
Okay, Fairview
and
Park
all the
Hospital
information should be
website.
there. Yeah, all the information should be within that webpage.
Well, that's great. I think, specifically for people who have problems that want to be educated about it, I'm really proud that you guys take the time to, put the effort into educating people about how they can find relief, and especially if it's something that can prevent, leading to cancer.
Yes, there are very simple treatments that can prevent very complex problems in the future, and that doesn't only apply to reflux itself. I have given other seminars in which I have explained diverticulitis, hernias, and different things. So it's just very important to pay attention to what is going on with your health to get the appropriate treatment.
Yeah, diverticulitis in the colon is another
Correct.
really, really, really big area of concern that people should, definitely monitor themselves about.
Absolutely.
Because untreated, it can lead to really bigger issues as well.
Correct.
Awesome. Well, thank you for your time today. Is there anything else you'd like to add about the seminar or this particular disorder?
No, I think we have pretty much covered all appropriately.
Well, great. Thank you again for your time and just giving this resource to the community.
Absolutely. Thank you.